It has been said in the United States more than one-third of people are obese. One reason for this growing epidemic is that it can be related to someone's socioeconomic status. One can conclude that obesity and socioeconomic status go hand in hand. The current health problem that has affected Tampa, Florida is that lower socioeconomic status results in a higher chance of obesity. So, what is socioeconomic status? Socioeconomic status, SES, is often measured as a combination of education, income, and occupation. It is commonly conceptualized as the social standing or class of an individual or group. When someone has a low socioeconomic status, that usually refers that they have little to no education, are living in poverty, or have a blue-collar, low-hourly payment job that provides little to no support for the family. This is a picture of a graph that shows the poverty level in Tampa versus Hillsborough County, Florida. As you can see in Tampa, the poverty level is below is 19% versus Hillsborough County, that's at 15%, and Florida, that's at 15%. Down here, as you can see the same thing, the city of Tampa, the poverty level is at 19% versus Hillsborough County in Florida, which is at a lower 15%. On this slide is two graphs. One graph shows obesity and one graph shows inactiveness. On the obesity graph, wealthy people, their chance of obesity is about 27%, and as they get poorer, the chances of obesity goes up all the way to 32%. In the graph that's about inactiveness, the wealthy, for inactive, wealthy is about 23%, but as you grow poor, it goes up, so poor people are less active usually than wealthy people. The organization I reached out to that deals with this current public health problem that is affecting Tampa is Man on Wheels. Man on Wheels is located in Brandon, Florida, and my dad is on the
Board of
board of directors when it comes to Man on Wheels, and I'm asking him a couple of questions. So, Mr. Barnett, can you give us your position and background on Man on Wheels?
Yes, Johnny. I'm on the board of directors for Men on Wheels. The organization has been around for about 10 years, and we work with feeding the low-income people in Hillsborough County and reaching out to the schools and providing support to them financially and also through food.
What is the objective of Man on Wheels?
Basically, the objective of Men on Wheels is try to pull people out of poverty and to feed them their needs that they have and allow them to get out of the poverty and move into areas of the Hillsborough County where they can be served.
Do you think Man on Wheels has helped reduce obesity rates for people living with a low socioeconomic status in Tampa, Florida?
Yeah, I believe we have because what we do is we try to provide the best nourishment we can for the families as well as the kids. We actually have worked with schools and kids as in school as well. So we provide them food that lasts them up to a week, and we make sure it's as much nourishment for the family as possible.
My creative solution to help solve this public health issue affecting Tampa, Florida would be look for ways to improve the social and physical environment. In New York City, they have a program called Carts, which is a program that offers fresh and healthy foods. My goal would be to bring that program here to Tampa, Florida. Next, I'm going to show you a video about the Green Cart.
There are several things that we can do to make it more affordable for people to buy healthier foods. Green carts and mobile food vendors are able to sell fruits and vegetables at a lower cost because they move their produce more quickly.
La fruta que compran más es la banana, la manzana, ahorita la cherry, la fresa, el limoncillo. Sí, aquí ya muchos clientes nos conocen, ya ellos vienen. Nosotros tratamos de traer también barato.
Check it out, man. Look, he said the best price in here, the best apple, the best orange. Man, you see this is $1.50 for one. Here I pay two for dollars. Can't beat that. Thank you, my time.
Program. Other creative solutions that would help solve this public health issue would also be I would provide neighborhood resources to connect people and children, and also I would provide school programs such as Head Start, which can help children avoid staying at home and watching TV. These are the two media sources that I would use to convey my creative solution when it comes to this public health problem.